We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
The novel coronavirus, also named COVID-19, has now reached New York metropolitan area. And we knew it was inevitable. But why are we in pure panic mode and fear, avoiding Asian-owned businesses and restaurants and stocking up on boxes of hand sanitizers and toilet paper? In this episode, we will separate facts from fear to help reassure the Filipino community to not panic, but still take precautions. Since the situation is rapidly changing with new guidelines from the New York City Department of Health and the CDC, we urge everyone to regularly check the evidence-based guidelines from these reliable sources for the most up-to-date information. I, Rachelle Ocampo, am joined with my co-host Marilyn Abalos, who is a public relations, marketing, and project management consultant, also an arts, culture, and community writer for the Filipino Reporter and other media outlets. We have the honor to interview Deputy Consul General Kerwin Orville C. Tate of the Philippine Consulate. Consul Kerwin has been with the Department of Foreign Affairs for 20 years. He has served as a diplomat in various capacities, both abroad and in Manila. He comes from the Bicol region, my personal favorite, in the Philippines, and holds degrees in English, literature, and law. He most recently held a mini session of the coronavirus during the Consulate's General Assembly, updating our kababayans and Filipino community leaders of the latest updates in the Philippines. We are also joined by Dr. Elvy Barroso, who has 30 years of experience in public health, both internationally and nationally, focusing on infectious diseases, including the activities for the Bureau of Tuberculosis Control, and teaching as an adjunct professor in nursing schools across New York City, including Borough of Manhattan Community College, Hunter Bellevue School of Nursing, and New York University College of Nursing. She will help us better understand what the coronavirus is and how we can best prepare for the fast-spreading coronavirus. So, Consul Kerwin, let's get right into it. There is no doubt that the epidemic is changing lifestyles all over the world, not just New York. Like people staying home, classes now being conducted online. What is the Philippine Consulate doing to take precautions to keep your staff and the Filipinos who visit the center feel safe and feel reassured?
We've already set out an advisory for the Philippine community and the community at large to inform them of the steps that we're taking in order to avoid our people from getting infected, and of course as also to avoid our people from becoming nexuses of or sources of infection for the community, because you know the Philippine Center in New York is one of the places where the Filipino community tends to congregate.
Yes.
So we put that advisory up in our website, and we've also put it up in our Facebook page. So the Philippine community might want to visit one or both of those, and we update our advisories as soon as we see any changes. But the most important part of the advisory is that we want the Filipino community to have as little personal interaction as possible.
Okay. So like all these, like getting passports,
yes,
getting your papers?
Unless you have actual, you need to be actually present in the Philippine Center. We are requesting Filipinos not to go there. That's one. We've also started to limit the transactions that we perform. A lot actually of the things that the services that the Filipinos go to the consulate for and the center for can be done online.
So anything that we have, any questions that we have, we can always contact the Philippine Consulate.
We have
check out your website and their Facebook for any updates.
Exactly.
Yes. And I've already received like 2 in just this day or 2.
Right.
All the updates.
So
thank you
it's a great way of knowing how you can best minimize your exposure, because you don't want to be walking around too. If there are alternative ways of transacting with the consulate, why not go to our website and find out just what you can do, and you might be surprised that you can do it all by mail, or you can do it without having to go personally to the consulate.
Yes, and just to step back, let's find out what the coronavirus is. Dr. Barroso, can you give us a little idea of like what are the symptoms? How do we know if we have it?
Well, the symptoms of COVID, the 3 major ones are cough, fever, and shortness of breath.
Okay. And so when you have those symptoms, what should you do? I mean, I'm being told you shouldn't go straight to the ER because we don't want the influx of people to go to ER, but really call your doctor.
Right. So the first thing that you need to do is to call your primary physician. So according to what the primary physician evaluates or make an assessment, your doctor will give you instruction on whether you stay home or you go to the nearest urgent care or you go to the emergency room. So it all depends upon the findings of the physician.
Yeah, I also heard it's the reason why we don't want everyone to go see their doctor right away or go to the ER right away is because if you are infected and you end up going to a public space or even traveling there, you might end up getting like 20 other people. It's just a ripple effect.
Right.
So really making sure call your doctor first.
And the doctor makes or coordinates that to the ER to make sure that I have a patient coming in so they can prepare the
Because you might end up just having symptoms of the flu. Is there a difference between, there are all different kinds of lung ailments, and so is there a difference between the flu and this COVID? It's very subtle. Is it very subtle?
Coronavirus and the influenza virus, they are both droplet organisms.
What does that mean?
So that means that we have 2 types of organism. One is the droplet organism, one is the airborne. Droplet organisms are organisms that are bigger. So we say it's not seen by the naked eye, but it's microscopic, but it's bigger than the airborne organisms like tuberculosis.
Oh,
so
that's a big difference. Okay.
Yeah, so it's bigger. So the recommendation of the CDC and WHO, if you have symptoms of coronavirus, the best is to wear a mask. So the mask will trap the organism because the droplet is a little bigger than the airborne. So you prevent the virus from spreading. So the recommendation is to wear a mask when you show the symptoms of coronavirus.
So I feel fine, but I see people on the subway and the buses wearing masks. Should I wear a mask as well? People keep asking, so.
Yeah,
what
the CDC and WHO recommendation is to wear a mask if you show the symptoms of coronavirus.
Okay.
But if you don't show the symptoms, you don't need to wear a mask.
So you don't need to wear a mask, right?
Yes. There are people who are asked like, who actually needs a mask? That is like the main question, because now they have like this stylish masks that have like prints and like little cartoons that don't really protect you. It's really for the people who are sick so that they don't spread.
So that they don't spread the virus.
Right.
Yes.
So the mask will prevent you from spreading the coronavirus, but it's not going to protect you from getting it.
And the people who are wearing it that are not sick, they're not even wearing it correctly.
Right.
Yes.
Oh, really?
Yeah,
There
because
has to be a specific way of
way
wearing
away.
those.
And
Yeah.
also the masks they use are the ones that are disposable that you should only be using for
Yeah.
that one moment, not
Right.
the entire day, overnight, multiple days.
So it's not going to protect you from getting the virus because the regular mask is not a tight sealed mask.
Yes.
So it's not going to protect you. So that's the advice of the Department of Health is to just use the mask if you have symptoms.
And another reason that I found about wearing masks and trying not to wear masks if you're well is because there's a shortage for healthcare providers,
Right.
the
Right.
ones who are actually treating
Yes.
the people who are ill. So if there's a shortage, how are we going to protect our own healthcare
That's correct.
providers? And the nurses, the frontline people. So really, do not wear masks if you are well.
And people have a tendency if like I heard several times already, no one is immune from fear,
Yes.
unfortunately.
Yes.
Yes.
And once your
Agree.
fear gets there, people tend to lose it, and when they buy masks, they're not buying it by the piece, they're buying it by the boxes,
Yes.
stockpiling hundreds of them. If you're staying indoors and you're not going out, there's no need for that. But logic is the first victim of fear, and people don't think straight really well.
Yeah.
But we've also asked for us. We've also asked our people to wear gloves, not because we're afraid of them getting it, but because wearing gloves prevents you from touching your face.
Oh,
Yeah.
yeah, that's
Yeah.
another thing. I
That's-
didn't think of
It
that.
prevents
I didn't think of that.
not for anything, but because if you're wearing gloves, the tendency is you don't touch your face
Yeah,
as
you
much.
don't. That's true.
And clean hands and don't touch your face.
Yes.
That's
That
what the medical professionals. I'm sure the doctor here will agree with me on that.
Yes.
So don't touch your face. Practice hygiene. All the major health organizations always say that good hygiene, especially hand hygiene.
I like
Yes.
what you mentioned at the General Assembly during the coronavirus session. You were mentioning how this fear really takes control, and people end up sharing misinformation. So really making sure before you share things on Facebook or on Twitter, find out if it's verified first from a source that is reliable
Yes.
before you start spreading more fear and more misinformation.
The spread of fear is 10,000 times faster than the
Yes.
spread of the coronavirus.
Yes,
Yes.
unfortunately.
Or maybe 20,000 times faster.
Yes.
So and people are sharing information about things that aren't really going to help. So before we click that share button, Google exists for a reason. Let's find out. The Centers for Disease Control in Atlanta, the New York State Department of Health, the New York City Department of Health, those organizations are professionals. They're staffed by truly dedicated medical experts, and they will give us the advice that we need. Let's go to them. Let's not share somebody from some information that you got on some Facebook page that you know
Yeah,
nothing,
yeah.
that you've not verified, or from Twitter experts, or from Viber groups that yesterday shared pictures of cats, and now
Oh.
they're sharing steps
There's a
on,
lot,
on
yes.
coronavirus.
Yeah, Viber,
Please.
WeChat. But I know, Marilyn, you were asking before about travel.
Yeah, there's a lot of apprehension about travel, especially Filipinos and Filipino Americans who have made plans or will be making plans to travel to the Philippines. And some people, scheduled to leave, next week have canceled their flights. Others have plans for later this summer or will be making plans to travel this summer. How safe is it, to travel to the Philippines? People are very concerned whether they should continue with their travel plans or cancel trips or whatever.
It really depends. The situation is changing even as we speak.
Yes, it is.
And who's to say that the Philippines is not going to ban travel to the United States. The United States at this point has a lot more cases than the Philippines does. So who's to say that the Philippine government will not just say, you can't go to the United States.
Right.
COVID-19 is prevalent there at a much higher rate.
That's true.
We should think about it that way. And secondarily, our advisory, we have emphasized time and again, before you travel, make sure that you go to the websites of the Departments of Health or Immigration of the countries you'll be going to. The situation right now is really, really fluid. And we see spikes in places that used to not have them, but it's everywhere now. Like I said, the individual countries will have their own sets of restrictions on and advisories on travel from certain destinations.
So the main point is really, it is changing. We can't say that you should or should not until you actually find out from the website and the travel agencies and the countries that you're traveling to.
But I must say, travel prices right now are pretty low.
I know. I heard it's pretty good to travel right now.
Right now, if you dare. If you dare.
So some of the latest stories, even as of today, is that travelers, some of them because other passengers are sick or show signs of symptoms or actually sick, they're quarantined for 2 weeks. So what exactly happens during a quarantine if you're a traveler, or even like for the case of New Rochelle, there's a number of people who are quarantined. So what happens when you're quarantined?
What really happens is that you stay home for 14 days. You can do the usual indoor activities that you do, but the health authorities will ask you to check your temperature daily and also to report how you feel. And they will also give you instruction. If you manifest the sign and symptoms of the COVID, you can call your physician, or you can, from there, if you have severe symptoms, you can go to the emergency room.
Doc, one of the things that I've always wanted to ask is, if you're quarantined at home, what happens to the rest of your family? Where do they go? Do they stay there with you?
Yeah, but they give you instruction on what to do, what not to do around family members.
Because, not everybody lives in multi-bedroom places in the city. If you live in a one-bedroom apartment and there's 4 of you, you're in close proximity. You're going to infect all of them.
Right.
So what happens if you're all ill? And if you're all seriously ill?
Well, again, it all depends upon the advice of the health authorities. If everyone is sick in the family, if the symptoms are mild, you can just stay home and again to check the temperature and see if the symptoms are getting better or getting worse. If it gets worse, they give you instructions on where to go.
Yeah. So really not relying on what you see online, calling your doctor, making sure that they're informed,
calling the doctor,
so that they could give you the best advice, because you can't just think like drinking apple cider is going to help.
Or
whatever.
drinking chlorine.
Or Fireball whiskey.
Anything. Do not do any of that, please. No taking shots of anything. Please talk to your doctor and let them know how you feel, whether it be one person or the whole family. But there is good news. There has been a case of someone who's contracted it in like Washington, and they've went to the hospital and now they're feeling better. They've actually recovered. So it's not something that's, once you get it, it's fatal.
Right.
Once you get it, you have symptoms. There are people who have it and are asymptomatic.
The fatality rate so far is
so low.
I think around 3%. So 97%, the vast majority of people, and this is what I read from the verified literature. The vast majority of people are going to feel mild symptoms. Some will feel bad symptoms.
Yes.
They will really get it badly.
Yeah.
But the vast majority, more than 50%, it will be like a mild case of the flu
And
for
it-
them, if at all.
Yeah, it all depends upon the immune system of the person.
Exactly.
So some may manifest mild symptoms, some may manifest severe symptoms. It all depends upon the resistance of the body.
Yes.
So does that mean the elderly are a little bit more vulnerable
Yes.
because of
Yeah.
their,
Because
you know,
of the
their
weak
bodies?
immune system.
What about the children?
For the children, it's also because of their immature immune system. So they're not able to fight the infection.
Yeah, there's also like what I was saying before about the fear that has been like all over the community. People avoiding Asian businesses. People are actually getting attacked because they look Chinese. I mean,
Right.
have you seen any of these in your experience or heard of any instances?
We know the ones that are publicized.
Okay.
Not just here in New York, but abroad as well. It doesn't speak well of us as humanity that we can do that. I mean, I was having a discussion about this, and you know, the first news that came, nobody was eating in Chinatown,
Yeah.
That's
and now
right.
it's rampant in Italy. So
Yes.
what are we going to do? We're
There's
not eating
not
Italian
one
one
anymore.
Asian person who has
We're
it
not
so
eating
far.
pizza anymore.
And yeah,
Yes.
it's really incredible. I was also at an event, a Filipino event, and I mentioned how I'm going to have dinner in Chinatown. She's like, "Oh, don't eat there." I was like, "I literally live, work,
Yeah.
and eat there every day. I'm fine, and I'm pregnant. I'm fine. I'm not in panic mode or fear mode, and I really want to help reassure the community that if I'm not, concerned, other people should feel a little bit more reassured. As long as I wash my hands properly for 20 seconds, singing happy birthday twice.
Happy birthday twice, right?
Yes.
Mine's row your boat.
Oh, really?
Twice.
Okay.
Yes.
Row,
Whatever
row.
the case is, you
As long
should
as
really
it's
make
20
sure
seconds.
take precautions.
Yes.
Really
Right.
making sure that you take regular safety precautions. That's right.
But you know that observation of and that phenomenon of not eating in
Yes.
that's a deep-seated
Right.
condition of the human of society that deserves another show by and of
Yeah.
itself.
So
Right.
if
Believe me,
really, if
it's-
I
Yeah.
could ask anyone, just please support your small businesses.
Mhm.
They do not deserve this. Not every Asian person has a disease. It's
Right.
not it's not.
And it's all over. And it's all over the
It's
world.
yeah, it's all over the world, not just here in New
Yes.
York.
Yeah.
I was just in Chinatown Thursday. I ate lunch in one
Next
of
time,
the.
text me.
Yeah, I know, but it's a little empty.
It is empty, yes. So I really hope that people support our small businesses.
Right.
And one other thing is, what are the safety precautions? What can we do that's better to make sure that we are safe and feel reassured? So other than washing our hands, is there
Yeah.
anything else that we should be doing?
What is
The
this about?
best way to avoid illness is to not to be exposed to somebody who has the coronavirus. So that's the best.
Well, some people say avoid large crowds going to the theater or rallies or conventions. What is your take on that? And how do we convince Filipinos who, there's a big dinner dance coming up in 2 weeks. Should they not go or should they cancel the event? So it's a delicate balance there to figure that one out.
Well, for us, it's having confidence in the fact that if you go by the numbers, let's go by the numbers.
Yes.
If we have 200,000 cases worldwide, and the human population is 7.3, 7.4 billion, so your chances of getting it is 1 in 35,000, 36,000. Pretty low odds, I think.
Yes.
Yeah.
Really, really low odds.
And
So,
yeah.
I think we just need to take some precaution.
right.
If you know that you have existing chronic disease that weakens your immune system. So it's better for you to take precautionary measure, not to be in crowded places, but otherwise, we just have to continue our life.
We have to live our lives the way
exactly.
we have.
I would love to end on that note because I really want to reassure people at this time, at the time of this taping, and things can change. You could always look at the CDC website for more. You should still live your life. You don't have to avoid large gatherings or crowds or any of that, or avoid mass transit, as long as you know you have hand sanitizer just in case, and wash your hands before, after.
Right.
Don't touch your face or your nose, your eyes, anything. So we do have to begin closing the episode, and I'd like to ask Consul Kerwin and Dr. Barroso, what is your one piece of advice for the community about the coronavirus?
And I've said this before, I'll say it again. Wash your hands.
Okay.
Wash your hands or sanitize. Sanitize properly, I might add. There's lots of advice on the internet on how to sanitize your hands properly, how to hand wash properly, and stop touching your face.
Yes.
With that, your chances of getting it are pretty low.
And Dr. Barroso?
And I think my advice is to take precautionary measures and be up to date with evidence-based information coming from CDC and Department of Health.
Yes, that is really my last thought, is really a final reminder to please check the CDC and New York City Department of Health for the latest guidelines on precautions and travel updates, since it is rapidly evolving situation. Thank you again, Deputy Consul General Kerwin Tate and Dr.
Thank you so
Elvy
much,
Barroso.
Rachelle.
Yes.
It's an honor to be here.
For joining us here at Makilala TV. Maraming salamat to all of our viewers and the Manhattan Neighborhood Network, MNN team, for your continued support.